Going into surgery can feel a little bit like you're boarding a flight you didn't exactly book yourself. You know it's necessary, you know it's for your own good, but you're still wondering, what's going to happen? Who's flying this thing? And will I get the good snacks afterward or what? I'm Dr. Daniel Medell, an anesthesiologist, and this is 10 questions every patient should ask before surgery. Question 1. What exactly is the procedure and why is it necessary? Okay, this probably sounds really obvious, but you'd be surprised how many patients can't explain their upcoming surgery in their own words. If you can't, it means the conversation with your surgeon isn't done yet. Ask things like, what is the exact name of this surgery, and what specific problem is it fixing or preventing? I once had a patient who told me he was having his knee cleaned out, but that's not what it said in the OR schedule sheet. So I asked the surgeon, and it turned out he was actually having a full knee replacement. Big difference. Once he understood, he could ask better questions and prepare for a much longer recovery. Knowing the why not only gives you peace of mind, it also helps you understand the risks and benefits. It's your body. You deserve more than just a vague idea of what's about to happen to it. Question 2. What are the risks and possible complications? This is the part no one likes, but it's really important. Every surgery, even small ones, have risks. So don't be afraid to ask things like, what's the most common complication from this surgery? And what's the rare but serious one I should probably know about? If your surgeon can answer these clearly, you'll feel more confident that they've really thought through your specific case. And don't forget to ask your anesthesia provider about complications too. For example, post-operative nausea, vomiting, and headaches are pretty common. But a lot of people forget to ask about the anesthesia because they're really just focusing on the surgery and the recovery period. But believe me, trying to recover from a serious operation is zero fun when your head is spinning and you feel like throwing up for hours or even days afterward. Question 3. Who will be in the operating room with me? An operating room is a real team environment. There's the surgeon, anesthesiologist, surgical techs, nurses, sometimes students, residents, or fellows. Ask who will be directly responsible for my anesthesia, and ask to meet them before your procedure if you haven't already. You can also ask who will be assisting the surgeon. This isn't about doubting anyone's skill, it's just about knowing who's on your care team and what they'll be doing while you're asleep on the operating table. One time a patient asked me, "Are you the one who's actually putting me to sleep?" And I said yes, and she looked really relieved. She thought the surgeon would somehow be doing it between incisions, I guess, I don't know. But the OR team is bigger than you probably think, and knowing who's who can be reassuring. Question 4. What type of anesthesia will I have? There are many different types of anesthesia. There's general anesthesia where you're completely asleep. There's regional anesthesia like a spinal or epidural, and sedation, sometimes called twilight sleep. Knowing which one you're getting helps you prepare for the recovery. For example, general anesthesia often means a longer wake-up period, while regional blocks can keep you comfortable for hours afterwards. It also helps you ask follow-up questions like, will I be needing a breathing tube, or will I feel anything? The answer should never be, oh, don't worry about that. The anesthesia provider or team should have a well-thought-out plan for your case before they even come by to say hello. One time I had this college football player booked for an elbow surgery, and he just assumed he'd be fully asleep for it. But when I told him we could just do a nerve block with some light sedation, he got super excited, saying, "Oh, awesome, does that mean I can watch the whole thing and ask a bunch of questions and stuff?" Well, technically yes, but do you really want to be distracting your surgeon away from your elbow the whole time? He laughed and said, "Yeah, I guess you're right. Just give me a good nap then, doc." You got it. Question 5. How do I prepare before surgery? Pre-op preparation can mean fasting, meaning no food or drink for a certain time, stopping certain medications, or doing special skin washes to reduce infection risk. Ask things like, when should I stop eating and drinking? And which medications should I take or skip on the morning of surgery? I remember one time I had to cancel a surgery because the patient told me he'd eaten a muffin that morning. He thought no breakfast meant no cooked breakfast, like muffins don't count as food or something, I don't know. So yeah, these details might sound small, but they can be the difference between a smooth day and a canceled one. Question 6. What is the expected recovery like? Knowing how long you'll be in the hospital, when you can return to work, and what pain levels to expect is huge. Ask, will I need physical therapy? How soon can I shower afterwards? And what are the limits on lifting or driving? This helps you set up your home, work, and support system before surgery. You don't want to be worrying about that and trying to arrange for help with getting around or having groceries brought in while you're trying to recover from a painful surgery. Question 7. What are the costs and insurance coverage? Okay, this is not the most fun topic, but it is essential. Medical bills can be even scarier than the scalpel sometimes. Ask your hospital or surgery center, what exactly does my insurance cover? And are there separate bills for anesthesia or the facility? You don't want any surprise bills while you're still recovering from that big operation. A lot of people are shocked to get a separate anesthesia bill in the mail. Most people think the surgeon's fee covers everything, but a lot of times it doesn't. Asking ahead of time can save you a lot of financial stress later. Question 8. What are my alternatives? Sometimes surgery is the best option, but sometimes it's just one of many. Ask things like, what would happen to me if I didn't have this surgery? And are there any less invasive alternatives? If your surgeon can explain why this procedure is the best path for you, you'll feel a lot more confident moving forward with it. Question 9. How many times have you done this specific procedure? Experience matters. A surgeon who's done several hundred of these is different from one who's done 5 or 6. It's okay to politely ask, how often do you perform this surgery and what's your complication rate? Surgeons don't usually mind this question. In fact, most of them are proud to answer. The more times someone has done a particular operation, the smoother and safer it usually goes. Their answer also helps you judge whether you're in the right place or not. You're not insulting them, you're gathering important safety information that could have a direct impact on the rest of your life. Question 10. How will pain be managed after surgery? This is the one I wish more patients would ask me about. Pain control is so much better when we plan ahead for it. Ask things like, will I have a nerve block, IV pain medicine, pills, or a combination? What side effects should I expect? And how can I avoid nausea afterward? A lot of people try to tough it out and not take their pain medicine after a surgery because their pain just isn't so bad right away. But it's important to remember that on a scale of 0 to 10, it's a lot easier to maintain your pain at a 1 or 2 than it is to try to bring your pain down from a 10 to a 5. So try to stay on top of your post-op pain, and don't be afraid to tell the doctors and nurses how you're really feeling. The better your plan, the smoother your recovery will be. And knowing the plan ahead of time means you're not trying to figure it out when you're already hurting. Remember, it's your body, your health, and your right to understand exactly what's going to happen. Surgery can certainly be nerve-wracking, but asking these 10 questions puts you in the driver's seat. If you know what to expect, you'll be calmer and better prepared for your special day. If you found this helpful, please hit that like button, subscribe for more Inside Anesthesia tips, and let me know in the comments what other surgery questions you'd like me to cover. Thanks for watching, and I'll see you next time.